Today we are going to talk about diabetes management. And the core issues in the management of diabetes include nutrition, exercise, patient education, monitoring, and the drugs. So in the dietary consideration, the first thing that you have to check on is the patient's body mass index. If the patient is overweight, obese, then you need to take that into consideration. Then the next thing that you need to consider is the patient activity level. Then the age and sex of the patient, because of various issues that are concerned at different ages. Then present food habits. What is the patient commonly feeding on at the moment? The economic status of the patient. This has an influence on what the patient is capable of feeding, and also the kind of drug that you're also going to use on the patients. The presence of complications at the time of diagnosis. Depending on whether complications are available, then this will have an implication on how tight the control of the diabetes of the patient is, and then the treatment of the diabetes itself. What drugs is the patient using? Those will also affect what kind of dietary advice you give on the patient. So on the diet, you want to ensure that there is weight control. So the calorie intake of the patient should be taken into consideration. Then providing the necessary nutritional requirements, because you want to be sure that your patients, even if they have to eat less, then the necessary nutrients, including the carbohydrates, proteins, vitamins, and even the micronutrients are provided by the patient is using. Then allowing good glucose control, and also make sure that the glucose is close to normal as possible. On the exercise part, you want to provide physical fitness to the patient. The exercise should help the patient decrease the weight and also increase insulin sensitivity. As you are aware, is that most of the patients, especially with type 2 diabetes, they are obese or overweight, and so you need to have their weight control. Then you also want to decrease the risk factors for cardiovascular diseases for the patients, and also ensure that the exercise helps decrease blood pressure and also increases the cardiac work. It has been shown actually with exercise and diet and weight loss, if a patient can be able to control their weight, then patients who are in the pre-diabetic stage, they prolong their time to getting full-blown diabetes, and patients who have been having full-blown diabetes, you realize that they will decrease the drug use, and they also have less complications. In fact, some people have said that if you can control your weight, then you can get out of your diabetes without much ado. Exercise. Let's talk more about the exercise. And one of the things that is critical when talking to patients about exercise is the use of the proper footwear during the exercise. This will prevent injuries to the feet, and especially that with diabetes, the sensation, the nerves are affected, and so the patient might not be able to feel the pain if their nerves are not working appropriately. Avoid exercises in extremes of temperature, when it is very, very cold or when it is very hot. This, especially when it's very hot, you have more risk of dehydration, and in very cold temperature, then this has also other implications of the immunity of the patient. It's always good for the patient to inspect their feet to check for points of bruises, ulcers, and if possible, they should have a second person to check on their feet, because sometimes patients with diabetes, they have their eyesight affected by their diabetes, and they might not be able to see. And then also the capacity to see all the parts of the foot, and they should be checked without shoes and without socks. And then Avoid exercise in periods of poor metabolic control. This means that when patients, for example, they have an infection, they have abdominal stomach problem or any illness, then it will not be very good time to exercise. And then it is also good, it's advisable that they don't exercise on an empty stomach or exercise with a very full stomach, because this also will affect their tolerance to the exercise. Then on the part of monitoring, there is what we call the ABCDs of diabetes. One, when the patient presents to the clinic, it is always necessary for the health provider to check their glycated hemoglobin. It should always be less than 6.5 for patients who are very well controlled. Then we are also monitoring their blood pressure. We also want to monitor their cholesterol. There's always need to continue with the diabetic education. Every visit to the health facility or an encounter with a health provider should be an opportunity for health education. Then eye examination, so that many patients become blind from diabetes because of retinopathy. And this is something that can be reversed if it is well detected on time. Foot examination. The health providers should always make sure they check the sensation of the feet, they check the blood supply, and so the patient should be examined in between the toes. The patient should be examined without shoes and socks. Then, of course, there is the glucose monitoring. They can do the fasting blood sugar or the random blood sugar or the postprandial sugar. Then, the general health of the patient, because diabetes does not occur in isolation. Then there is also, does the patients have indication for referral to other health providers, like for eye examination, oral examination for oral issues? All those should be considered. So thank you very much.